So risk factors for the pancreatic cancer, of course. Why do you think most men are affected by pancreatic cancer than women? So let's now start opening up our head a little bit. Why do you think, because I want you to think critically, why do you think pancreatic cancer is more prone in men than it is in women? Somebody is still asking on this live, what causes cancer in small children? Cancer that is in small children is the same cancer in older people. And if you do not watch the live that we talked about on Monday, there's just a live that is next to this one. The previous one is talking about all the basics of cancer. So please make an effort. Go there, watch that live, and then come back to this live again. You will enjoy. Amazing. Finn, thank you so much for that answer. Thank you so much. Prof, thank you. Thank you, Halima. Yeah. You see? So you guys have answers. There is a reason why cancer of the pancreas is more prone or more prevalent in men than it is in women. Because one, women have abilities to cope with stress levels. They know. Number two, one of the predisposing factors or the risk factors for all cancers, we say it is alcohol and cigarette smoking. And guess what? Who are the strong or larger consumers of alcohol and and cigarette smoking? It's almost very rare to see a lady smoking, right? Very rare almost. But nowadays, ladies are so unethical. Ladies are taking mirror. So this one, remember, alcohol intake. Chronic alcoholism causes pancreatitis and now activates proto-oncogenes to oncogenes. Now problems with the pancreas. So men are so stressed up, they can't handle stress because, of course, they lack identities. And number two, men are heavy consumers of alcohol. Men are heavy smokers. Therefore, this type of cancer is very, very prone in the men than it is in the women. Number two, of course, age is coming in handy. Why do you think age is coming in handy? I will tell you this one. It's because you've been consuming all these inflammatory foods for the longest period of time. By the time you're getting the diagnosis, you've actually done yourself justice. You've done yourself justice. By the time you're actually getting this diagnosis of pancreatic cancer, you have done yourself justice. You've eaten all the inflammatory foods that this world offers. You've drunk all the alcohol. You smoked your lungs all through. So now this diagnosis is basically just the body trying to reward you for what you loaded in, garbage out. You've done justice. Not injustice. You've done justice because you wanted it. You did it wanting it. So you knew that was the best life, right? So we can't say it's injustice. It's you who actually who is supposed to say it's injustice. But the one who is saying it, you've done yourself justice. Umekula chapati zote kwa sababu unataka kula chapati. And some of us are running away from poverty. Whatever we thought that is the rich lifestyle is what we're actually trying to chase. So when you can afford a few coins to actually buy food, you are running to buy all the unhealthy foods because you're running away from your poverty. You're thinking you have a wrong idea of wealth. It's true. But those people who come from Nyeri, Muranga, Karatina, and all those people from Mrima, they're the heaviest consumers of alcohol. They're the heaviest smokers. Anyway, let's continue. So old age, but this old age is because one, your organs are actually failing automatically, and the immune system is actually going down. Number two is because you've consumed all these foods for a long period of time. So by the time you're diagnosing you, it's a long period of time. Cigarette smoking is there. Of course, don't forget alcohol. Of course, don't forget diabetes. And how does diabetes relate to this cancer? Number one, you had a problem with the pancreas. You destroy your beta cells. You are now unable to control blood sugars. So therefore, diabetes is coming in handy. And then when diabetes is coming in, it is the number one disease or condition that actually lowers the immune system. So diabetic people who have been diagnosed with diabetes, they always have low immunity because sugar is holding on to the white blood cells. And that is a problem. Another one is obesity. So as you grow fat and as you complain that we are body shaming you, we are helping you. There's nothing like body shaming. You're just fat. Fix it. And if you're emotional about it, find an identity on Identity Fridays and then go fix yourself. You know very well you're not okay being fat. You're not. So don't tell us how to call you. We will call you fat because we know fat is that obesity. So what are the symptoms of pancreatic cancer? Symptom number one, of course, you've obstructed the ducts. Of course, what we're going to get here is the jaundice because we are building up the bilirubin. Number two, you're going to get a lot of itching. Why? Because you've blocked the tubes and now the bile salts are actually accumulating and leaking into the blood, causing a lot of itching. So yellow skin, which is very itchy, yellow eyes, and now abdominal pains. And when you sleep on your back, there's a lot of pain, epigastric pain. So you're thinking it's ulcers, yet it's a epigastric pain that is coming from this. Of course, weight loss is coming in, malnutrition. Of course, a lot of bleeding, therefore anemia is coming in. We expect the stool to have a lot of fat. So you trying to flush the stool is greasy, it's not going. Inashizunguka tu ikifika chini inarudi juu. That is steatorrhea, the fatty stool. There is something else called the Trousseau syndrome or sign. Trousseau sign. Those doctors, they know this. Now, I don't want to term that word Trousseau. I want just to know there's a sign that is very specific for this cancer. But this sign is this way. You see, somebody who has tetanus, if you tie a blood pressure cuff on their hands, okay, because of that pressure, what happens is their wrist and their fingers start to, there's this spasm. That's what we call the Strauss sign. We get this Trousseau sign, we get this. But for these people who have pancreatic cancer, when you tie that, what is going to happen is something that we call migratory thrombophlebitis. Do not cram that name. I want to break it down to you for you to understand. Migratory, migration, it moves. Thrombo means a clot. Phle means the vessels, blood vessels, the veins. Itis means inflammation. So therefore, migratory thrombophlebitis means we have a clot in the veins that is basically migrating. Comes into the hands, before you notice it is disappearing, is into the legs. Before you notice it is disappearing, is into the abdomen. That clot is, those clots are always moving around. That's what we call migratory thrombophlebitis. And that will happen when you tie this here. Now, you see, this is a very weird sign or symptom. How will you even know that? You must do a physical examination. You must get a very adequate history for you to actually tap out that symptom. It takes you a whole time, my friend. You must be very thorough with the history. So it's so hard to actually diagnose these people of pancreatic cancer. So you simply look at the physical observation. Do you see jaundice? Yes, check. Do you see unexplained weight loss? Check. Do they have appetite or they lose appetite all the time? Yes, check. Do they have a fatty stool? Yes, check. Do they have this sign when you try to do the vitals? Did you see any sign of the Trousseau sign? Yes, check. Do they have fat-soluble vitamin deficiencies? Because these fat-soluble vitamins, the fats is going to be digested by the bile that is coming into the small intestine, but because they have blocked it, there's no digestion of fats. That's why we have that fatty stool. So therefore, we are unable to absorb the fat, and we are also unable to absorb the fat-soluble vitamins, vitamin A, D, E, and K. So do we have vitamin D deficiency? Yes. Do we have vitamin K deficiency? Yes. How do we know? If this guy gets a wound, he's constantly bleeding. Now, I want you to hold these things that I'm saying because I'm going to ask you a question, hapa mbele. I'm going to show you how the syllabus frames the questions during the exams for pharmacists, for medical officers, so that you can actually see. So does this guy have vitamin E deficiency? Yes. How do we know? We see him having a lot of infections. His system is so highly inflamed through the CRP test. Is this guy having epigastric pain? Yes. Has he been treated for ulcers before? Yes. What happened? It came back. And now, what is the other symptom? He actually suffers a lot of pain when he's sleeping on his back. Physical observation. Is there itching? Yes. And is this itching accompanied by the yellowness of the skin? Yes. Are there black skin tags on the skin? Yes. So you see, a lot of information is needed to actually get the diagnosis of pancreatic cancer. Has he done a gallbladder surgery before? A removal of the gallbladder? Yes. What was the cause? Obstruction. Was it the gallstones? Yes. Another history. And appropriate diagnosis starts with patient history. You must be so keen about that history. Oh, you must be sure. So doctors on the platform, you now know. Before you diagnose this one, a lot of things. A lot of things. Is there anemia? Yes. Check. So imagine all these things. And then which other organs are affected? Is the liver okay? Have we carried out the liver function test? Are they clear? Yes. Are the kidney function tests clear? Yes. Is the lungs okay? If he's breathing, is the breathing normal? What is the SpO2? Doctor, repeat about the back pain. Yes, when they are sleeping on their back, there is this epigastric pain. You see the pain that you feel during a reflux disease. We call it epigastric pain. But this one is very specific. When they are sleeping on their back is when they are feeling the pain the most. It starts with the abdominal pain and then the epigastric pain. Problems. So diagnosis has to start with the history, and then now we can send for radiology to do an ultrasound, abdominal ultrasound or the pelvic ultrasound. Then we can do a CT scan to just confirm. And then now you see all other tests that we've done, the liver function test, the kidney function test, the CRP, the HbA1c, all of them we've done them. We've taken even the medication history. How much is those tests? How much will you already spend on diagnosing only? You've not even started the chemo. This is just diagnosis. Umeona venye ni ngumu kudiagnose pancreatic cancer. By the time wanafika hiyo diagnosis, wewe uko stage 3, stage 4. Tuna palliative. We now have to do away with the pancreas and the duodenum. And then in the labs, we can do something called the CA19-9. There's a test that is specific for the pancreatic cancer. It's called CA19-9. So it's a tumor marker for pancreatic cancer. There's another one called CEA for the colorectal cancer, but it can actually be used to actually confirm that there's no colorectal cancer and this is the pancreatic cancer. That's what we call the differential diagnosis. It's shading out all others and taking us to one direction. And then after that, you can actually send it for the biopsies. So by the time you're getting the biopsies, so I don't even have to talk about, yes, Jeremy, that one. So we don't even have now to talk about the treatment, because we know if it's already at this level, we cannot treat it. If it's the tumor side, of course, it's not localized, it is in one place, we can easily do away with it through surgery. But this other side, if it's malignant, so it's spreading through the lymph, we said it's is one that spreads through the lymph. So it's already in the liver, in the kidneys, in the lungs. It's difficult for us to treat it. So simply supportive care. And now 5FU or gemcitabine, the chemo. But remember, those chemo are not for treatment. They are not for treatment. And if it's a tumor, you can simply do the Whipple. We call it the Whipple procedure. The Whipple procedure is the one that actually does away with the pancreas plus the duodenum. So have you gotten anything here?